Welcome to this comprehensive guide on intercostal drainage. We will cover anatomy, physiology, ICD insertion technique, care, and potential complications. Let's begin with the anatomy of the intercostal spaces. These spaces lie between adjacent ribs and are filled by intercostal muscles. The intercostal neurovascular bundle lies in the costal groove along the inferior margin of the superior rib. This is crucial for ICD insertion. The diaphragm is balloon-shaped with the right dome higher than the left. Insert the ICD above the sixth rib to avoid abdominal visceral damage. Understanding the levels of pleura and lung in relation to the ribs is essential. Insert the ICD above the sixth rib for safety. The triangle of safety for ICD insertion includes the lateral edge of pectoralis major, base of axilla, and fifth intercostal space. The physiology of respiration involves negative pressure in pleural spaces. ICD helps when there's a breach in the pleural barrier. Water-sealed bags are used for drainage. Timing the removal of ICD at end inspiration or expiration reduces pneumothorax risk. This diagram shows a water-sealed drainage system used with ICD to prevent room air from entering. Studies show that chest tube removal at end inspiration or end expiration has similar rates of post-removal pneumothorax. The history of intercostal drainage tubes dates back to Hippocrates and has evolved significantly over time. Modern intercostal drainage tubes are made from PVC and silicone, featuring multiple drainage fenestrations and radiopaque stripes.